We follow students in Birmingham and Manchester.
I want to listen to your chest.
Juggling academic study.
Nothing's going in.
With home life and work on the wards.
You're never going to learn how to be a nurse until you're out there doing the nursing job.
This time, sirens.
There is a time limit. This is urgent. This is real.
Setbacks.
You can't see or feel it from that.
And shocks.
What do you know about the heart?
As our nurses-to-be step up to the challenge of 21st century nursing.
You look like you're doing very well.
Sorry if I do ask questions, because I probably will.
Please do.
Let me know if you need anything. All right.
In Birmingham, second-year student nurse Aimee is 10 days into an 8-week stint on Good Hope Hospital's stroke unit.
Being a nurse, it's not just about hands-on clinical skills. You've got to be able to react to any situation. You've got to deal with a working environment that's constantly busy. It's never a set routine.
Stroke is the third leading cause of death in the UK. Rapid response is crucial.
Sorry to interrupt, just to let you know I've got a fast positive alert if you want to attend down. Okay.
Charlotte is a specialist stroke nurse. She's been called to A&E to assess an emergency admission.
When Charlotte came in and completely interrupted the conversation and said, look, Aimee, we've got 7 minutes to do this, this, this and this, it was quite, oh my God. There is a time limit. This is urgent. This is real. It's not, it's not something that you just watch on TV. You never know what you're going to come across. You never know how bad the situation's going to be.
I believe you weren't very conscious when the ambulance first arrived.
I'm getting a bit tired now, which is normal.
Which is normal for you. Do you suffer from any other medical problems?
72-year-old diabetic Dorothy collapsed at home.
Diabetes type 2.
Her symptoms suggest stroke.
If you are in a situation where you think, right, this is a bad situation, we do need to do this, this, this and this.
I need to see if there's any problems that may be suggestive of a small stroke.
It comes back to professionalism. You've always got to do the best job that you can.
If you're looking at this lady, what can you see straight
Obvious
away?
facial treatment.
Left facial droop.
Left-sided.
Yes. Let's look at your husband a second.
Right up this and come round here.
Yeah, so it droops. Yeah, it drooped on the left side.
Aimee has a personal interest in understanding more about patients like Dorothy. Her grandfather died after a stroke, and a year ago, her younger sister had one too.
Going onto a ward where the nurses have a hell of a lot more knowledge than a nurse on like a generalised ward, I think it'll be quite informative to me and my family. So hopefully I can take a little bit more from the placement.
For all student nurses, there's a lot to take in.
It's my notebook that I bought, because after the first day I was a bit taken aback by all the things I've got to learn. But you can see that as I'm getting more nervous, it's just not going to work, I just can't read it.
Nursing new boy Alistair has a 2-week placement on the orthopaedic unit at the Royal Bolton. He's getting hands-on with patients for the very first time.
Let me know if I'm hurting you.
Seeing, nurses on wards, it just looks like it comes so natural, but so much, underpinning knowledge and, training that goes with it. I don't think it's an easy choice at all. You've got to want to do it.
24-year-old Alistair used to run his own business fitting floors.
I'll try and keep you stay as lively as possible.
Now he's given it up for a university degree in adult nursing. As a novice, Alistair gets all the best jobs.
Got to find a commode, but I don't know. Commode?
Yeah, I'll show you.
Sorry, mate.
That'll be one of these.
Right. Right, okay.
Okay.
It's smells that get me.
Feces.
I think I've got a gag reflex in my nose.
That one got me a bit.
I'll deal with anything, but I might have to get, is it Vicks? I might have to get some Vicks, on my moustache. If I wanted to be a nurse, but then refused to help someone who's incontinent, or change a catheter, or do all these things, then you're not going to make a good nurse. You're not going to be a nurse. There are pros and cons to every job. I'm not saying it's a pro for me, cleaning, but it's got to be done.
It's the first time I've done this year, so. Just got to clean this chair. I think this is the most glamorous it'll get. Apart from like a work night out.
How you doing, Al? You okay?
Yeah, not too bad, yeah.
Good.
Just cleaning this commode, now I know what one is.
Give it another 30 years, you'll be sick of the sight of them.
Yeah, that's my first one.
First one ever.
First one used and cleaned.
Oh.
Not by myself, I don't.
All by yourself. What a hero.
I'm not too posh to wash now. No, I'm not posh at all, no. Can you not tell with the accent? Common as muck.
In Birmingham, second-year student nurse Dany is on a placement in A&E.
Is it all right if I do your blood pressure and that?
Dany first started training as a teenager, but then ill health cut short her studies.
It was always there in the back of my mind, what if? To have the chance again is just brilliant.
30 years on, Dany's letting nothing stand in her way.
Coming up for 8 hours. I haven't eaten since 6:30 this morning.
Nowadays, there are many more opportunities to specialise than there were 30 years ago.
What do you know about the heart?
Well, it's nice we've all got one, and it helps if they beat.
The first thing to tell you is the machine doesn't pick up...
Dany's being put through her paces by cardiac nurse Trevor.
Most of the time, people think that every single thing that is done in a hospital, every single person can do that. However, that's not the case. The case is that there are specialist nurses like myself who are actually really highly trained to actually perform certain tasks. Let's do it. The easiest thing to do.
For Trevor's expert knowledge to rub off, Dany must get to grips with the science and some complex terminology.
We've got a gentleman in Resus 1 who needs a DC cardioversion. So have you ever seen a DC?
No.
Okay, right.
No, you've just spoken a foreign language to me there.
Jeff has come in with his wife and son. He has a heart condition that, without medication, makes his heartbeat irregular.
I've missed 1 or 2 of the tablets this week, and I think that may have be associated with me being poorly today.
We don't give him any sympathy though. The dog's tablets are right on top of his that he gives him every night. Give the dog his tablets and take your own. Simple.
You do deserve it.
You do.
Thank you.
Jeff's heart needs an electric shock to try and get it back into rhythm. It's a procedure known as a cardioversion. For Dany, it's a chance to see at first hand the weight of responsibility carried by a specialist nurse.
Hi, Jeff. All right? You all right? Okay. When we shock you, all these extra impulses that are flicking off will stop, and then your own heart will kick back in on its own. Okay. However, in the very, very, very rare occasion, we have to support that with a bit of CPR, so that's that pressing on your chest thing. Okay. I've never had to do it, and I've done probably 200 of these. Okay.
Well, don't start to.
No. Okay. Brilliant.
That's great. Thank you.
But at the moment, you can see his heart rate's only about 134. Now, it'll fluctuate, and that's because the machine is going to have difficulty. So the best way to estimate somebody's heart rate who's in atrial fibrillation?
No idea.
Feel his pulse.
I was about to say, could I feel his pulse? Can I feel his pulse? Just
we all rely on these machines far too much.
I can feel this.
You can feel it? You feel it irregular?
Yeah, I can feel it irregular. Makes me sound a bit sad, doesn't it, getting excited about somebody's irregular pulse rate. But it was just that realisation of some things that you're taught, that's it, you know. That's really quite interesting.
Yeah.
Sorry, I've never felt somebody who's got... I've never felt someone who's got an irregular pulse.
So, 1 pad. That's his heart. This is where it's going to come through, like I said there, so you just stick it there.
You don't have to wait till the lightning hits the tower or anything.
Nah.
But they do have to wait for the anaesthetic to kick in.
It's like the calm before the storm.
Second-year Aimee wants to learn everything she can from specialist stroke nurse Charlotte.
Hello. Hello, Dorothy. My name's Charlotte. I'm the stroke nurse here at the hospital.
Stroke is the third biggest cause of death in the UK and causes more long-term disability than any other disease.
Can you look up for me? Can you open and close your eyes? Okay.
For Dorothy, who's come in with Raymond, her husband of 54 years, a quick diagnosis is vital to treat any bleeding or clotting on her brain.
Can you remember anything what's happened before you took unwell?
I felt all right, actually.
When you're looking at a stroke patient, they say act fast. You look at the face, the arms, the speech and time. It is so important to actually follow that.
Can you tell me what month it is?
No.
Yes.
October as far as I know.
Let me hold your arm.
No, we're not quite in October, it's September.
September, October is Raymond's birthday.
Her speech was slightly slurred. It wasn't dramatically impaired, but it was slightly slurred, and she did have an obvious weakness on her left side.
Brilliant. Do you know whereabouts you are now?
Hospital.
Okay. Do you know which hospital? Brilliant. Can you do a big smile for me? Okay, show me your teeth.
What teeth?
Yeah, you look beautiful.
When Charlotte did her assessment, it was quite interesting to watch. Looking at sort of the physiology behind that, you've got to realise that if a patient couldn't do that, then something would be wrong, obviously, in the brain. She's still presenting symptoms of a stroke. They're just querying now whether it's the early symptoms of what could possibly turn into a bigger one.
Charlotte has ordered a CT scan to see if there are any bleeds or clots on Dorothy's brain.
There's so many different things that people don't understand about stroke, the recovery times, the different types of rehab, and so for me, especially because it is close to home, it is extremely interesting, and I am looking forward to learning a lot more about it because it's not just a placement for me, it's personal.
Second-year student Dany is on the third week of her clinical placement.
Systolic blood pressure has to be above 90 for you to feel a rate of pulse.
After a 30-year break in her training, she's still getting to grips with the high-tech kit available to modern nurses.
It's all a bit overwhelming, isn't it? Again.
Patient Jeff's irregular heartbeat needs treatment under general anaesthetic. According to specialist cardiac nurse Trevor, there can be unusual side effects.
One of the things that happens with patients who've had propofol is they have erotic dreams, especially the ladies. Apparently, I haven't ever experienced it before myself, so I can't comment on it, but apparently they do.
Can't say as I've had it.
They are hoping to shock Jeff's heart out of the condition known as atrial fibrillation, or AF. If left untreated, it could cause a dangerous blood clot and lead to a stroke.
Oxygen away, please. Everybody stand clear. Charging. AF still clear. No, back in AF.
If the shocks don't work, alternative treatment will be required.
I knew the heart was complex, but you know what I mean. This is just like something else. There's, you know, there's so much that can happen to it.
Stand clear. One more shock. Stand clear. It's irregularly irregular, so still in AF.
Still in AF.
Yeah,
that's a shame.
Gap there.
Oh, yeah.
Jeff's heart rate continues to fluctuate. His treatment will need a different approach.
I just felt for him that it didn't work, but to see it, you know, in action is really, really interesting.
How are you doing? You had a lovely sleep, Pete.
Yeah.
It hasn't turned around and got you back into a normal rhythm yet? No, sorry. You feel okay?
It's a bit shocked, really, yeah.
Yeah.
Well,
yes.
Shocked in both ways.
Yeah.
Trevor prescribes a strong heart medication for the next few weeks. Jeff will be monitored closely. If this doesn't work, he may require surgery. For Dany, it's been a revealing insight into modern nursing.
I feel like I've been hit by a train, I do. But really interesting. I find it fascinating. It's just trying to get a general grasp of it.
Not everybody has an aptitude for the subject, and that's fine. I was no good at the kidneys, I admit it. I could never understand how the kidneys worked, it just did my head in. But actually, from a student point of view, she did as well as any student I've ever had.
When Dany first started training 3 decades ago, a nurse's career options were more limited.
I think that's what you aspire to be, is like a specialist in your subject, whether it could be diabetes or tissue viability. I think it's a good idea to have a speciality and to be able to, you know, convey that knowledge onto other people, you know, and sort of be like a role model.
In Bolton, Raw recruit Alistair is on his first ever placement in the Royals Orthopaedic Unit.
I just can't wait to get started and get involved now. It's my time to achieve something, I think.
There are some nursing basics that never change.
Do my nursing corner.
Yeah, quite tight, that's it.
And that goes in. It's not a bad corner, that. My mum will have me making my bed. We're good.
He's under the strict supervision of mentor staff nurse James. With the more serious wounds and dressings, it's a case of look, don't touch for first-year Alistair.
OK, sir, so we'll come and do your dressing now, OK. Just like to...
Keith is recovering from surgery on his hip and leg.
We practiced in uni, in clinical skills, but never on a patient. I won't be doing it.
Never on a patient. Well,
no.
It only comes through practice, really.
Yeah.
To me, it actually looks quite clean.
I mean, it does look like it's healing really, really well, to be honest. I won't say I'm put off or anything. I just want to go and see a few more now. Might just pop in and start taking people's dressings off and see what I can see. No, I won't do that.
For the next patient, Alistair can be more hands-on. Taking a pulse is a basic essential a new nurse has to master.
If you don't mind, we let Alistair have a go with these as well, because he's not actually been let loose in the wild to do this yet, have he?
Oh, no real people.
Not as of yet.
Yeah. We'll take Mrs Himsworth's pulse. Now, best place to take that is radial artery, OK? Right. 2 fingers, and you rest it gently over that. Just slightly compress the artery, and you'll actually feel, you know, a bump, bump, bump. OK? And then you just feel it, yeah, just gently in there. You're not feeling that at all, are you?
That should be it.
Can't see a feeling through, man.
You can't?
Fingers, yeah. I know where it is. But
I think a little bit of nerves being let loose for the first time doing observations on a real-life patient. Can be a bit nerve-wracking and daunting. Do you feel that at all?
No, I can't seem to find it. Gutted. Not finding the pulse.
It happens, don't worry, you know.
Maybe I was pressing too hard because I was nervous. Or,
yeah,
you know,
yeah.
I'm blocking it.
It is, you know, it's a skill that comes with practice.
Yeah.
And
I mean, I know where it is. I've practiced, you know, a few times like that. But
yeah. I bet he feels really gutted. But he'll dust himself off. He'll come back and he'll remember now for next time. That's what we're here for. We're here to actually observe him doing it, correct any mistakes he's making, and actually give him the help and support that he needs to, you know, to become effective in that skill.
Aimee, whose sister and grandfather both suffered strokes, is getting a fast lesson in modern diagnosis, as suspected stroke victim Dorothy undergoes a high-tech CT scan.
Dorothy, we're just going to roll you over now, OK?
OK.
Though there's still a need for traditional nursing skills.
OK. Ready, steady, slide. OK.
How was that?
A lot better than that.
In the control room, mentor Charlotte tests Amy's knowledge.
Remember what we're looking for on the scan.
Yeah, any bleeds or
Yeah, so we're
clots
ruling out any bleeds in the brain with the CT scan. She's improving, which is a good sign. Yeah. So her clinical neurology is resolving. But we need to just make sure there's been no bleeding in the brain.
Dorothy appears to be making a remarkable recovery.
Most of her symptoms seem to have resolved now. She has still got a little bit of a facial droop, but her speech is a lot better.
Still be colder than that.
Mouth's very dry, isn't it?
Right on arm and get a lumpy voice with you.
She's a lot more alert. She is a real character. She's very funny. She's just joking around with all the staff now.
Perfect.
See, that's how you do it. You should have watched.
We can get the nice cup of tea now, okay?
Dorothy's stroke was a small one, and after 4 days she was discharged home to her family.
It is extremely interesting to know that it can happen and recover that quickly. For my sister, it took her a hell of a long time to overcome the weakness, basically teaching herself to walk again. Whereas this lady, although she wasn't mobile prior to admission, the way she's moving her arms, the way she's talking, she's made a dramatic recovery.
There's only one of me.
Next time.
I'm just dead enthusiastic about it. A bit too enthusiastic sometimes, I think.
Tough choices.
I don't really want to lose the house that I've literally worked the last 30 years for.
And close shaves.
No, we're not going to give 2 doses because then we'll be overdosing. So, yeah.
Oh, no.